So, yes, I'm so glad to be here again this year. And the topic of my presentation is general transitions, holistic options for hospice care. A little about myself is that I have been a hospice nurse for 17 years. I did this last year and I was like, whoa, did I say 15? No, like you just kind of lose count. It has actually been 17 years. And I got into hospice after the loss of my dad, and it was a terrible situation. And I wanted to be able to provide um, care to patients and their families, the kind of care that I didn't see with my dad. Um, and over the years, I've been in all kinds of roles in hospice, but predominantly I've been after hours and weekends. um, I also teach part time and have done that for the past 10 years, and for RN programs and BSN programs, and um, now LPN programs. And I find it really interesting that we still do not really teach more than, um, you know, a few minutes, a little small blab about hospice and end of life care, or a little bit more about geriatrics. But we do a whole semester of maternal newborn that most nurses never even get to practice in. So I'm hoping that we see that change. And it's the same in medical school. They're not talking about end of life care either. And we need to start having that conversation and getting practitioners more comfortable with talking about death and dying, and looking at death and dying and end of life in a different light than we do now. So I think that's how we can change the perception, is starting with education. Um, so last year I was voted the Grim Reaper by my weekend hospice employer. We have to have a little bit of a sense of humor in hospice, but at the same time, looking at the Grim Reaper, that's just something that is, everyone fears the Grim Reaper, right? There's a song, "Don't Fear the Reaper." I mean, um, we don't have to look at death and dying in this grim way. We can actually look at it in a more colorful light. And when we acknowledge the consciousness, and the piece that, this conference today actually discussing consciousness, then we can really start to look at it differently. Obviously, if I believed that death was something to fear and it was this horrible thing, I don't think that I could have been at the bedside of patients and witnessed death and dying for over this 17 years that I've done it. And and so it is hard sometimes to know innately that death and dying is coming for a patient, and I see the sadness and despair of the family members that are about to lose someone they really love, and all of the anxiety, the depression that goes along with that. um, a lot of times, not always, but sometimes it's really hard for me to know that they don't know, and I can't change their perception at this last minute. So that's something that we all do have to work on. And, I started hospice in rural Mississippi, where there weren't a lot of options to treat patients. And, and I became a holistic nurse and started to use things that I had available to bring comfort to patients. And a lot of times that was just my presence, because there wasn't a medication I could pull out of a box. Um, and I had to get creative, and I learned, um, actually trained as a hypnotherapist so that I could use guided imagery and just be present and help individuals to find peace in their own head, whether that was, you know, pouring lavender oil on myself so that that terpene could um, permeate their blood brain barrier and bring them some anti anxiety relief, or help myself in the situations too when sometimes patients were, their anxiety was getting out of control and their pain was getting out of control. Um, that journey kind of led me here to Colorado in 2009. And I saw this hospice that was using massage therapy and music therapy, and I thought, this is just fabulous. And I was going to go to acupuncture school and did to kind of learn some more different therapies and acupressure and different points that I could use to help bring comfort to patients. Um, so, fast forward, like I said, there was no comfort kit in rural Mississippi in 2007. Um, there just wasn't anything available. And then we started to utilize comfort kits, and we're sending out all of these medications to people. And certainly it was beneficial for certain situations. And still, there was a lot of people who did not want to utilize morphine. They really did not want um, to be unconscious. They wanted to be awake. They wanted to utilize the last days of their life to make connections and memories with their family. Uh, then cannabis kind of came into my vision really once I got here, and um, started realizing that it actually was a medication that could help individuals. And so that started my cannabis nurse journey. And so just going from hospice nurse to holistic nurse to cannabis nurse to being able to bring whatever education I could to patients and family members on their options, and being a voice, as Jamie said, for patients, um, being able to let them know what they want is what matters the most, and to take away the fear that they may have with utilizing some of these alternatives to morphine or Xanax or Haldol or whatever we send out in the box. Um, because there is still a lot of fear, and now we have ketamine, which is, and psilocybin and all of these other things. And I have to say, on this little picture here of the Be Ketamine actually came off of our pharmacy website. And, we are beginning to utilize the ketamine in different ways in hospice than it has traditionally been used for things like depression, so that patients who are just unable to shake that sadness can actually be awake and smile or talk or sleep without fear of dying. They start to become more accepting of the place where they're at. And then we really have to look at the caregiver situation as well. So sometimes those things that we have aren't really enough to bring comfort to patients. There's an underlying fear, um, and or there's energy going on between caregivers and family members, and maybe it's not fully understood what they all need, but allowing to talk about what they really want, what is their goal, finding out what their choice is. And that may in fact be something like medical aid in dying. They may be at a place where they don't want to continue on a trajectory where they feel like they are a burden to their family, and they are just ready to take that leap. Uh, they may be limited by some of these products that they could use because of the facilities that they're in, or even the disease processes that they're facing. And something like dementia or ALS can be really limiting on what they can do for themselves and even what they can process. So, trying to prepare for our own death and dying, or help our family members to prepare, because we know that that is something that is coming to all of us at some point, and making our needs known, putting it in writing is so important. Um, and then for caregivers who may be working full time, they may be taking care of a parent while they're also taking care of their own life, their children, their, you know, so much going on, and and so that just not to be themselves. So it's important to recognize, while we can't say here is a bottle of morphine for you for the caregiver, we can talk to them about the use of cannabis and or psilocybin in a few a few areas now, and ketamine everywhere. Like Jamie said, in 50 states we have access to that. Um, and it is important that maybe the caregiver and the person who is dying can have experiences alongside each other and share what they see. The reason I think that psychedelics is making its way back into the hospice world, a lot of the research that was done in the 60s, in the 70s, that's shown how that anxiety and depression can just kind of fade away with a one-time dose, um, and change the perception and the fear. And that is something that these medications that are generally the other prescriptive medications, they do not have the ability to do that. They only have the ability to mask the symptoms, and to cause a sedative state for patients, and even for the caregivers. And as I went through my dad's death and that experience, I remember being in Texas, and just, the circumstances were not good. It wasn't something that we knew was going to happen, and it was abrupt, and he was brain dead, and there I was for months in a place that I didn't want to be, without the support that I really needed, and I had no tools of my own, even though, you know gosh, I can't believe it's been that long now, but at the time I did not have these other tools in my tool bag. um, and I wish I had. And I took Xanax at that point, and it really took away a lot of that moment for me, and to really be able to be present with my dad when my mind was just blank on Xanax, um, so that I could just get through it. And that's, at the end, when you've lost someone and you look back and you go, I lost them, but I also lost that moment. And that's painful. So we can actually give a gift to the family members and the caregivers by sharing with them that there are ways that they can be in this space. And even though they may feel that loss and grief coming on, they can process it, and they may be able to look in a different light. So, being able to integrate consciousness into the dying process really starts with looking at our options. And I'm glad you brought up Dr. Drayson too, and Dr. Sunil and the Ames Institute. I mean, they are doing phenomenal work. Just how they are getting to care for these patients in a way that no one else in the country is really able to do. And collecting the data and sharing the results in journals and showing that these patients are having a better quality of life at the end of life. And that's really what it's about. Um, and so Dr. Snell says, consider euphoria, aversive memory extinction, sensorium enhancement, and spiritual incitement catalyst. They play a therapeutic role for patients faced with despair. They change that perception. Um, when you are able to look at our connection, not only with one another, but with the universe, and see that this physical world is only just a small blink of what we experience, and then we can prepare for that transition. I think at that point we can start to appreciate the sacred place that we are at during transitioning. Our family will be able to also see that sacred place, and then we can celebrate that minute, that life, for the time it was here, and celebrate that it's breaking free and healing. Like, this is conscious healing. When we die a death of our physical body, that is conscious healing. It's hard to imagine that people don't go into hospice with the thought of, I'm going to heal. But when I see them and I see them on their way out, that's what I know. I know that they are about to heal and they are going to break free from any pain and suffering. Um, so without death, there is no life. We are here for just this brief moment. Um, and our jobs as nurses are to learn to be open-minded, to be non-judgmental. Some people need to know that you support them regardless of their choice. They may want to be sedated, and that is fine as well, because again, it is their choice. But they may want to be awake. And I think those of us that are in this space right now, as consciousness is surrounding us and pulling us in, um, we're not going to want to die the deaths of our grandparents. We don't want to die in a dark room alone. Um, and that's what these plant medicines are able to give us now, is that connection, that oneness, that beauty, that comfort, and complete loss of fear.